Hi, my name is Frank, and I started a YouTube channel. As an emergency medicine physician, I want to try to accomplish several different things. I want to try to provide some insight into how healthcare professionals see the world in somewhat of a different light. I also want to provide an outlet or catharsis for myself, because I've got a lot of stories to share if you're willing to listen. And hopefully along the way, I can provide some level of entertainment. Now I'm going to be totally honest and extremely frank. This is my channel. Hi, my name is Frank, and I am an emergency medicine physician, and I started this channel to hopefully provide some level of insight on how health professionals see things a little bit differently than the non-healthcare professional out there. I mean, I've talked to a lot of my friends, and we definitely have a different take on certain topics, and hopefully I can provide some insight and share some experiences and hopefully provide some entertainment. In addition, I'm hoping to talk about a lot of different topics and bring some guests on and have you hear about their take on their perspective on healthcare as well. For example, one topic I want to talk about is trampolines. You know, when I see trampolines out there, when I see kids jumping in trampolines, I see a bunch of future ER patients, and I hate to say that. It sounds kind of cynical, but that's kind of how I see it. And the reason why is because having worked in the emergency department for so many years, all I see is the end results. And so I see a lot of the injuries that occur from people who have gotten hurt from trampolines. You know, for example, when I see kids on trampolines, especially when they're jumping around all together, I think about them running into each other, bouncing off cycle and hitting their heads and causing a stellate or a jagged laceration on their forehead. And this is a time when the trampolines are a lot safer. I mean, the trampolines typically have, typically coverings now, but the earlier trampolines did not have the coverings back in the day. And they were a lot more dangerous. But now with the coverings, it's a little safer. Although, like I said, I can't help but think about all the injuries that still occur with those and that have occurred. And some of the trampolines don't even have the springs covered, where the springs are left uncovered. And then I have seen so many broken wrists and broken ankles and, people flying out of them and having some head injury. So that is, certainly that is my concern with the trampolines. Here's a few examples of how dangerous trampolines can really be. In this first video, you see these kids are jumping, and this kid lands on top of his head and back of his neck, and it looks like he really injured himself and hurt his back and his spine. This next example, this gentleman is jumping, and he actually lands through the exposed springs, injuring his neck and head, and most likely his upper extremities, and that looks so painful. Ouch. In this last example, this trampoline has a cover, and regardless of the safety feature, this kid actually flies far enough that he lands outside the cover and hits the upper part of his body and probably injures his neck and arm as well. And this looks so bad from an ER doctor's standpoint. I mean, ouch. I mean, that's terrible. I'm not condemning trampolines, and I'm not going to lie to you and say that my kids were never on a trampoline, because they have been. All I will say is that we have never considered purchasing a trampoline for our family just because of the concerns I have. I will say that when my kids were on the trampolines, however, I watched them quite closely to make sure that there was not too many kids together, and they were being somewhat careful because of what I've seen in my experience. But it was it was full of anxiety and full of concern for sure. Another thing that I have a little bit slightly different perspective on is the bungee cords that you use to, wrap up your luggage or something on your roof rack of your car. The elastic cord with a J hook on them. And having talked to other healthcare professionals, and my brother, one of them, who's a retina surgeon, there are certainly some concerns that have been brought to my attention. Those things, when you're using them to, for example, strapping it around like top of your car over a roof rack, you hook it on one side and you pull it, and it's quite a bit of tension. And if for some reason that J hook breaks off or dislodges, it comes flying back at quite some speed and under quite a bit of tension, and it comes back in a straight line, and it comes back at you, and it can cause some significant injuries. One of the worst ones that I hear about is when they come back and hit you in the eye, and it can cause some traumatic injuries and even blindness. In this demonstration, you can see there's a bungee cord, J-hook bungee cord being pulled taut. And the problem with these J-hook bungee cords is that if they for some reason slip or the J-hook comes off its mountings or it breaks, you have a small metal object coming at a very high speed. And what we worry about is that it hits you straight in the face or in the other parts of your body, but the worst part would be hits you in the eyes, and that would be obviously very traumatic. In this next demonstration, it's by a YouTube channel, Runaway RV Nesters, and in this is a couple that's talking about how they use the J-hook bungee cord to use things to attach things on their RV unit. And what happened was it dislodged, and the J-hook actually hit them straight in the eye, causing some pretty serious injuries. And they go on talking about what you can do outside of using the J-hook bungee. But my whole point is that these things can be extremely, extremely dangerous, and you have to be very careful. Now, I haven't seen this in my work experience, but it has been reported not that infrequently. And because of this, we don't own any of those bungee-like hooks. The ones I have are just the fabrics with the ratchet, where there's no tension, no elasticity. And I use that if I need to secure something, just because of the concerns I have with that. And because of my exposure and talking to other people, that's something that I look at things differently, and something I'm sharing. I know that as a healthcare provider, we're always trying to do our best, and we're always trying to provide the very, very best care for every patient that we see. And we do our best, and we're not looking for thanks or appreciation specifically, but what we're not expecting is some of the abuse, some of the criticisms that we see, and it's gotten worse because of the pandemic. It's one of the few fields I can say that, when I had a difficult case, I would go home and I think about it, and sometimes I call the hospital later on and find out how the patient's doing, or come back and visit the next day, and we take our work home with us, and it's something that's really, many times we make connections with the patients we see. And this is different from a lot of other jobs. And to be treated in this day and age with a lack of respect is certainly disheartening. We try to treat every patient, and I know I treated patients regardless of how my life was going at home, or if there was issues I was going through or not feeling well. I try to make sure that I treat every patient with the highest level of respect to the best of my ability every single time. And I think the public forgets that we are only human, and we do have our own issues. And sometimes it'd be nice if that was somewhat recognized, or have some understanding that, that we are not all perfect. We may try our very best, but everyone has their own pain points and issues. And I ask as a healthcare provider that next time you go see somebody or are treated by a nurse or a paramedic or any type of healthcare provider, to remember that everyone is dealing with their own issues and struggles, and we are all trying to do our very best. And especially our field, where we're trying to help ease your anxiety, your concerns, your pain, whatever you may be going through. And understand that this is a tough field. This is a field that demanded a lot of sacrifice. And I hope the public can somewhat recognize that and remember that the person that is helping you out or treating you is also human as well, and they are doing their very, very best. I hope to have additional content on a regular basis. I hope to have some guests. We have some different topics coming up. And if you have suggestions for topics, or if you have comments, please let me know. I hope to see you on the next episode.